Breast milk is the perfect food for your baby. It is nature's gift, designed to nourish and protect your little one. Breast milk contains all the nutrients your baby needs to grow and thrive. It also has antibodies that help fight off infections. These antibodies are especially important in the first few months of life, when your baby's immune system is still developing. Breastfeeding is not only good for your baby, but it's also beneficial for you. It helps your uterus contract back to its normal size after birth. Breastfeeding can also reduce your risk of certain cancers. These include breast cancer and ovarian cancer. Beyond the physical benefits, breastfeeding creates a special bond between you and your baby. It releases hormones that promote love and attachment. This closeness helps your baby feel safe, secure, and loved. As you embark on this breastfeeding journey, remember that every drop of breast milk you provide is a gift to your baby's health and well-being. It's a journey of love, nourishment, and connection. The first hour after birth is a special time for you and your baby. Place your baby on your chest, skin to skin, as soon as possible. This skin-to-skin contact helps regulate your baby's temperature, heart rate, and blood sugar. It also encourages your baby to latch on and start breastfeeding. Your baby's instincts will guide them to your breast. You can help by holding your baby close and supporting their head. Your baby may show feeding cues such as opening their mouth, turning their head, or making sucking motions. The first milk your body produces is called colostrum. It is thick, yellowish, and full of antibodies. Colostrum is often called liquid gold because of its incredible benefits. It is the perfect first food for your baby, providing everything they need in those early days. Don't worry if your baby only takes small amounts of colostrum at first. Their stomach is tiny. As they nurse more frequently, your milk supply will increase to meet their needs. A good latch is essential for comfortable and effective breastfeeding. When your baby latches on well, they can draw milk from your breast efficiently. To help your baby latch, bring them close to your breast, with their nose level to your nipple. Their chin should touch your breast first. Wait for your baby to open their mouth wide like a yawn. Then, quickly bring them towards your breast, aiming your nipple towards the roof of their mouth. Your baby's lips should be flanged outward, covering a large portion of your areola. You should see more of your areola above your baby's lip than below. If the latch doesn't feel right, gently break the suction by inserting your finger into the corner of your baby's mouth and try again. A good latch shouldn't hurt. If you feel pain, detach your baby and try again. Remember, practice makes perfect. With time and patience, you and your baby will find a comfortable and effective latch. Breastfeeding is a learning curve for both you and your baby. It's common to experience challenges along the way. The good news is that most challenges are temporary and can be overcome with the right support and information. One common challenge is sore nipples. This is often caused by a poor latch. Make sure your baby is latched on correctly. If soreness persists, apply a small amount of purified lanolin cream to your nipples after feedings. Engorgement, where your breasts become overly full and uncomfortable, is another common issue. Frequent feedings can help prevent and relieve engorgement. You can also apply warm compresses to your breasts before feedings and cold compresses afterward to reduce swelling. Remember, you're not alone in this. If you're facing challenges, don't hesitate to reach out to a lactation consultant or your healthcare provider for guidance and support. Section 5. Skin-to-skin warmth and connection. Skin-to-skin contact, also known as kangaroo care, has numerous benefits for both you and your baby. It helps regulate your baby's temperature, heart rate, and breathing. It also releases hormones that promote bonding and relaxation. You can practice skin-to-skin contact by placing your baby directly on your bare chest. Cover your baby with a blanket to keep them warm. Hold your baby close and talk to them softly. Skin-to-skin contact isn't just for the first few days after birth. You can continue to enjoy its benefits throughout your breastfeeding journey. It's a beautiful way to connect with your baby and promote a sense of closeness and security. Section 6. Your growing baby, milk needs and feeding cues. As your baby grows, their milk needs will increase. In the first few weeks, your baby may feed every 2 to 3 hours around the clock. As they get bigger and their stomach can hold more milk, they'll start to go longer between feedings. Instead of following a strict schedule, feed your baby on demand. Watch for their feeding cues, such as rooting, sucking on their hands, or making lip-smacking sounds. These cues indicate that your baby is hungry and ready to feed. Remember that every baby is different. Some babies feed quickly, while others take their time. Trust your baby and let them guide the feedings. As long as your baby is gaining weight and producing plenty of wet and dirty diapers, you can be confident that they're getting enough milk. Section 7. Maintaining your supply, nourishing your baby. The more you breastfeed, the more milk your body will produce. Frequent feedings are essential for establishing and maintaining a healthy milk supply. Aim to breastfeed at least 8 to 12 times in a 24-hour period. In addition to frequent feedings, make sure you're staying hydrated and eating a healthy diet. Drink plenty of water throughout the day. Focus on consuming nutrient-rich foods. Certain foods and drinks can affect your milk supply. Avoid alcohol, caffeine, and smoking. If you're concerned about your milk supply, talk to your healthcare provider or a lactation consultant. They can offer personalized advice and support. Section 8. Seeking support. You're not alone. Breastfeeding can be challenging at times, but it's important to remember that you're not alone. Many resources are available to support you on your breastfeeding journey. If you have questions or concerns, don't hesitate to reach out to your healthcare provider or a lactation consultant. They can provide expert guidance, address any challenges you're facing, and offer encouragement. Joining a breastfeeding support group can also be incredibly helpful. Connecting with other breastfeeding mothers allows you to share experiences, learn from one another, and find a sense of community. Remember, asking for help is a sign of strength, not weakness. Section 9. Embracing the journey, a time for bonding. Breastfeeding is more than just providing nourishment for your baby. It's a beautiful and intimate way to bond with your little one. Embrace this special time. Cherish the moments of closeness and connection that breastfeeding brings. As you navigate the ups and downs of breastfeeding, remember to be patient with yourself and your baby. It's a learning process for both of you. With time and practice, you'll find your rhythm and enjoy the many rewards of breastfeeding. Trust your instincts, seek support when needed, and most importantly, enjoy this precious journey of nourishing and nurturing your baby. You're doing great!